Hello, Mr. and Mrs. Sims. We just walked into Avow's non-hospice palliative care clinic. There's Katie. You've met her already a couple times. I'm going to show this cool lion that says care on it. This is the very peaceful waiting room for when we have patients coming in for appointments to meet with our palliative care nurses and other folks. This is Brandon.
Hi.
Brandon, introduce yourself.
I am the office manager here at Avow Palliative Care.
Do you speak with a lot of patients over the phone who use our services and
I do.
help out in various ways? Can you tell us briefly what is non-hospice palliative care?
Yeah, absolutely. Non-hospice palliative care is a form of care that allows patients to seek comfort and curative options, and we're kind of a supportive group where we have a nurse practitioner, social worker, and a chaplain, and we kind of just address the medical, spiritual, and psychosocial needs of a patient that's going through any sort of debility or life-limiting ailment.
So what are some examples of those ailments?
The bulk of our referrals are probably cancer patients.
Yep.
A lot of our local oncologists prescribe palliative care so we can help manage their pain, other symptoms.
While they're going through chemotherapy and
Exactly.
radiation and other things like
and
that.
a lot of emotional support is needed as well, so that's where our social work and chaplain come in.
Awesome. You guys are awesome. I love being here. Today's one of the days that patients are coming in the morning, but we could also be seeing folks out in the field in their homes.
Absolutely.
Katie, would you like to lead the charge and give us a little walkabout into each of these
And
sweet
if
rooms?
I can,
You can.
Brandon, how far away are some of the patients that we provide in-house care to?
Out in the field, the furthest we go is right now Immokalee, Ave Maria, that area.
Yeah, that's pretty
Probably
far.
the furthest we travel.
That's
And
great.
this is not hospice. This is not the
Correct.
hospice service. This is the non-hospice palliative care service. All right, Katie, walk on through. And we see first here we have a consultation room.
Here we have a consultation room.
Mainly a fax office now.
Oh, it's an office and fax office and consultation room. And
Here we go. Here's an exam room.
this is one of my favorite rooms in this entire space. You know why? Because this is a really cool massage room. Katie, do you want to, or I can, talk a little bit about the benefits of massage as a complementary therapy?
Sure. So massage is not just to help you relax, although it also does. There are different types of massages. In fact, we have one right now that can help drain your lymph nodes and really move fluids around and improve circulation and how a patient is feeling, and get the right medicine and movement. I'm not a doctor.
Nope.
But
we like to let the practitioners practice while we talk with donors based on our pretty good information.
Yes.
This is a consultation room that was actually designed for kids being seen in our palliative care program. They might be in our PIC program. So these are kids with life-limiting illnesses. It's a really cool design. Look at the little deer and the frog up in the tree. Oh, there's a snake and an alligator. I really enjoy coming into this space. And we do provide non-hospice palliative care PIC for a handful of young people through a Medicaid program called PIC TFK. All right, Katie, where are we now?
all right, so here we are in another room. This is more of an exam room. As you can see, it's a really wide and easily angled bed. And then we also have some seating and another, it looks just like a doctor's office, but in a really nice doctor's office.
And this was all funded through the generous contributions of donors. Back in 2017, we have office spaces here. These offices represent the multi-tier level of continuum of care that we offer. We have social worker, APRN, we have a chaplain, we have nurses in the field who are all making sure that not only our hospice patients are being served well, but also our non-hospice palliative care patients. Katie,
And their families.
and their families. Sorry, I always forget about the families. We're gonna close down this. Why don't you go out this back door here? I'm gonna just revisit the this space right here, which has a family consultation room. This is where people can meet to discuss the care. Things are always in flux, as you know, Mr. and Mrs. Sims. It's a beautiful view. It's a beautiful space. One thing that we have not yet done is named this palliative care clinic that is within the Lions Center. Some of the rooms are still available to be named. One day we would love to name this entire palliative care clinic. So maybe the Sims Family Palliative Care Clinic, who knows?